Have you ever wondered why some patients suddenly feel chest tightness while climbing stairs? But the pain disappears after resting for a few minutes. So, that chest pain may not be just because of gas. It could be angina pectoris, an early warning sign that the heart is not getting enough oxygen. And if we understand angina properly, we can actually prevent something much more dangerous, that is myocardial infarction. So, welcome back to the Pharmacotherapy Series on Pharma Palette, where we simplify difficult topics into easy, exam friendly concepts for Pharm D and other medical students. In today's video, we are going to complete all these topics under the angina pectoris. And don't worry, I will make it simple, logical, and easy to remember with tricks and flowcharts. So, before jumping into the treatment directly, first let's understand what exactly the angina pectoris is and why it happens. So, coming back to the definition, so what is angina pectoris? It is simply the chest pain or the discomfort in the coronary heart disease. So, to indicate this condition, there is a medical terminology used, that is angina pectoris. So, this is usually a clinical syndrome of the ischemic heart disease. So, what happens here? So, if this is a heart artery, if there is blockage or if there is narrowing of this heart artery, the heart muscle will not be able to get the sufficient amount of blood. It will be leading to angina pectoris. When there is blockade or narrowing in the heart arteries, that is called as ischemic condition. So, coming back to the classification of angina pectoris. So, first one is stable angina. This is also called as typical or exertional angina. So, this is caused by the atherosclerotic narrowing of this coronary arteries. So, this can occur during the exercise, stress, or during climbing the stairs. So, this will be causing increase in the oxygen demand. In the stable angina, the pain will be reduced by rest or by taking the nitroglycerin. So, in the stable angina condition, if the ECG is checked, it will be showing the ST segment depression. And second one is the unstable angina. Here it is usually caused because of the rupturing of the plaque and the partial thrombosis. So what is rupturing of the plaque? Simply if this is a artery, so if there is already formation or deposition of the fat that is having one coat, when that coat is ruptured, it will be spreading all over. Now the body thinks that there is an injury and it will be sending platelets over here, that leads to the clot formation. When this clot is formed, if it is blocking the artery, that is called as partial thrombosis. So in the unstable angina, the blood supply will be reduced even in the rest condition. So this is one of the most severe and the dangerous condition which may further progress to the conditions like myocardial infarction. So in the unstable angina, if you check the ECG, it will be showing ST depression. So in this case, the emergency treatment is required. So coming to the last one, which is the variant angina, which is also called as the prismatal or vasospastic angina. So here this occurs due to the coronary artery spasm, which usually occurs at the rest condition. So here there will be a temporary reduction in the blood flow. So here the ECG shows the elevation of this ST segment. So in this condition, the substances like vasodilators like nitroglycerin can be used to treat this variant angina. So, to simply remember all these three classes, in the stable angina, just remember that there is an exertion induced chest pain that is usually reduced when a person is on rest. And coming to the unstable angina, so here the pain usually occurs at the rest condition and there is also the risk of getting myocardial infarction. So, coming to the variant angina, so just remember that there is a coronary spasm due to which it is causing the chest pain, that too at the rest condition. So, coming back to the epidemiology, so this is most commonly seen in men, and almost 112 million people are affected by this angina pectoris. So, coming back to the etiology, so the main cause for the angina pectoris is the CAD condition, which is the coronary artery disease. So, usually, what happens in this is there will be narrowing of the arteries. When the arteries are narrowed, especially due to the conditions like atherosclerosis, there will be decreased blood flow. So, when the blood flow is decreased, it will be leading to the angina pectoris condition. So if we had to see the basic pathophysiology involved in this, so in the rest condition, if the blood flow is less, it can still be able to meet the oxygen needs of the body. But if the condition, if it is in case of exercise or in the stress condition, what happens? The oxygen demand in the body will be increased. So when the oxygen demand increases, there will be narrowing of the arteries. When the arteries are narrowed, it can't supply the sufficient amount of the blood to the heart. That's when the angina occurs. Today we'll see what all main points to remember in the each type of angina. So first one is stable angina. Here just remember the code as SECHS. So it is occurring due to stress, exercise, or C means it is cold weather, H means it is heavy meals, S means it is smoking. So these are certain causes for causing the stable angina. So coming back to the unstable angina, so just remember it as burst. So B means blood clot, U means it is unpredictable, R means even the rest cannot reduce this pain, S means it is severe pain, T means it is threatening, which requires the emergency support. And coming to the presmental, remember the trick as spasm, where S it occurs due to smoking, and this is a presmental angina, also called as variant angina, and this usually occurs. A means it occurs at rest, S means this causes coronary spasm, M means it will be mostly occurring in the midnight condition. So mostly the night attacks are more of for this presmental angina. So what is happening in the pathophysiology? It is very simple. So as discussed earlier, the atherosclerosis will be causing obstruction in the arteries. Second thing, the arterial spasm will be causing sudden obstruction that is usually reversible. And then it can occur due to atherosclerosis if there is rupturing of the plaque or if there is any thrombus formation. That will be occurring suddenly, but this is a non-reversible one. And all these three will be leading to the ischemia condition, where ischemia means it is decreased blood supply to the heart tissue. And next it will be leading to hypoxia condition, where hypoxia means decreased oxygen supply to the heart tissue, and this further leads to decreased oxygen demand, which will be leading to angina condition. And this decreased oxygen demand can further lead to thrombolysis, which will be resulting in the unstable angina. In this, the main symptoms are chest pain and chest pressure. And to remember the common symptoms, just remember the trick as TSH, where T means it is tightness, S means it is squeezing, H means it is heaviness. And next one, in this condition, there will be pain which will be radiating to various areas. To remember that, just remember the trick as Jensba, where J means jaw, A means arm, N means neck, S means shoulder, B means back, A means around the chest. So around all these areas, the pain will be radiated. Coming back to the some other symptoms, just remember the trick as sad fans, where S means it is sweating, A means it is anxiety, D means dizziness, F means fatigue, F can also be fainting, A means arrhythmia, N means nausea, S means shortness of breath. So coming back to the diagnosis of angina pectoris, simply remember this flow, ask, record, stress and see the blood flow. So first we are talking about the first three things. Ask means doing the physical examination. So you'll be checking for the family history of the patient. You will be checking for various symptoms like chest pain, or you'll be checking some risk factors which are causing the angina. So like that the physical examination and the history will be done. And next one is to record. So in this case the ECG will be checked, which is simply the electrocardiogram. This is usually performed to mainly identify the electrical activity of the heart. So this is useful for detecting the reduced blood flow, and also it shows certain abnormal rhythms. Coming back to the third one, which is stress. So here we have stress test and the nuclear stress test. So in the stress test, what happens? The patient will be allowed to walk on the treadmill. At that time, the ECG and the BP will be monitored. Why this is done means, in this condition, the heart will be working harder. The heart will be under the stress, helpful for easily identifying the angina condition. And if the patient is not able to walk, in such condition the drugs will be prescribed, which will be further stimulating these exercises. And then the last one is the nuclear stress test. In this condition, the radioactive dye will be injected mainly to check the blood flow of the patient. And this nuclear stress test can also detect the areas which are having the poor supply of the blood. So for example, if you check the scan, if there is any dark areas in it, that means there is less blood flow. So coming back to the last few diagnostic tests for the angina pectoris, mainly to see the blood flow, here simply remember the code as EC-CAB, where E means it is the first test, that is echo, which is echocardiography. In this condition, the sound waves will be used mainly to see the structure and the function of the heart. So this echo test will be useful for detecting poor pumping, or if there is any heart muscle damage, or to identify the areas which are not having the sufficient amount of blood. And next one is C. C means it is chest x-ray. So this is usually performed to identify the heart enlargement and to know the different lung problems. And next one is C, which means it is cardiac CT scan. So remember C as CT scan and MRI scan, where CT scan is usually done to identify the narrowed arteries and to identify the enlarged heart. Similarly, the MRI scan is mainly done to identify the detailed structure of the heart and also its blood vessels. And coming back to the next one, which is A. A means remember it as angiography. So coronary angiography will be performed. This is one of the most important tests to identify the angina pectoris. So this coronary angiography is called as a gold standard test. In this condition, the dye will be used to that dye is injected into the coronary arteries. After that, the X-ray will be taken mainly to know, by after observing this X-ray, we will be identifying the exact site of the blockage. Last one is B, which means blood test. In the blood test, this will be mainly performed if there is any heart damage or if there is any condition like MI. And also, for example, this is also blood test will be performed to identify which enzymes are reduced, which enzymes are increased. For example, troponin is an enzyme that increases mainly in case of heart attack. So coming back to the non-pharmacological treatment of angina pectoris, so this usually includes certain lifestyle modifications. And to remember the non-pharmacological treatment, just simply remember one simple code, that is sweet CRAL, where S means it is stop smoking, W means it is weight reduction, E means it is exercising safely, E means to eat healthy diet, T means it is to treat the comorbid diseases first, C means it is to control the stress, R means it is to rest between the activities, and A means it is to avoid the heavy meals, L means to limit the alcohol. So till now, we understood what angina pectoris is, why it occurs, and how to identify it, and the important lifestyle and non-pharmacological measures that are used in this management. But now comes the most important and the most asked exam area, the pharmacological treatment of angina pectoris. So to know how does a pharmacological therapy actually reduce the myocardial oxygen demand, cover all of that in the next video on the pharmacological therapy of angina pectoris in a simple pharmacotherapy focused way. So don't miss the next part of this series. If this video helped you understand the topic better, support Pharma Palette by liking, sharing and subscribing. See you all in the next video. Thanks for watching.